Hello, my name is Megan, and for my nursing case management presentation, I will be presenting a case report on a patient with COPD. The patient I've decided to do my case manager report is going to be referred as RM, a 56-year-old Caucasian man who is currently a patient at a skilled nursing facility I work at. RM is divorced with no kids and reports that his main support system is his ex-wife. He has completed an associate's degree and was formerly a police officer in Texas before he had to stop working due to his illness. 2 years ago, he was diagnosed with COPD, and for the past year, he's been a resident at the skilled nursing facility due to the progression of his disease. Currently, RM is receiving physical and occupational therapy as he has become so weak that he can no longer ambulate by himself. Due to having severe COPD, he also receives medications and respiratory treatments. He has recently started a new type of therapy called vest therapy. He wears a vest that oscillates his chest wall to remove excess mucus in his lungs. Self-care capacity. While caring for RM, I have concluded that he is mostly compliant with adherence to his treatments. He quit smoking several years ago when he first discovered he had problems with his lungs. He's compliant with all prescribed respiratory therapy and medication therapy and is actively involved in his treatment. He wants to know all medications he's taking and will always look up a new medication prescribed to him on his iPad before agreeing to take it. RM will always tell the nursing staff or his doctors if any of his symptoms become worse or if something is changing in his health status. In regards to his functional capacity, RM does have difficulty carrying out ADLs, IADLs, and mobility. RM is able to independently perform most ADLs that include grooming, hygiene, and feeding. He needs assistance with transferring to the commode or wheelchair, but is unable to walk or climb stairs independently. Due to the fact that RM resides at a skilled nursing facility, his IADLs are severely limited. He's unable to drive anywhere, cook, do laundry, clean the house, etc. He is able to effectively manage his bills at the facility as well as make phone calls or appointments. Discharge planning issues. Because RM is already out of the acute phase of care for his illness and is in a rehab facility, the next step would be for him to return home either by self-care with family or home health. Discharging a patient home with the support of the family would be the best option. Because RM requires a higher level of skilled care, home services such as RN visits, PT, OT, or home aides may be a good option. Outpatient services are available for physical therapy and occupational therapy. The discharge planner would also consider where RM lives and will be able to get his prescription medication, as well as how he will be able to afford them. I believe the best option for RM is for him to be discharged home with health services. Although one problem with RM is his in-laws suite that he lives at. There are 10 stairs for him to climb. At this point would be too difficult for him to reach. He would either need to find a different location to live with no stairs or get physically stronger to be able to safely live at home. Although he has trouble ambulating, he is able to safely transfer himself from the wheelchair and would benefit from continued visits from occupational and physical therapy, and perhaps a caretaker that visits him on a daily basis. Because RM's only social support person is his ex-wife, outpatient services at a rehab facility may be difficult for him if he is not able to drive. The patient-level nursing case management strategies I'm going to use with RM include empowerment and coaching system management. For system-level strategies, I'm going to use risk management. Interventions at patient level. RM sometimes would say, I'm not getting better. I feel like my progress has stopped. By empowering him, he would be able to see that he is indeed making progress in reaching his goals. I would want to actually actively work with RM and mutually share our knowledge with each other in order for him to reach goals and to improve his health status. Facilitating healthy changes can be difficult due to the complex and fluctuating nature of a patient, but it is essential the nurse has skills in empowering patients. In order to build a trusting and non-judgmental relationship, I would listen actively and objectively to any of RM's concerns, problems, or stories, and will also offer my own experience and knowledge, if appropriate. Education about disease management and symptoms is always needed for a chronic illness in order for the patient to gain greater self-care capacity. When implementing his plan of care, I would want to assess his knowledge about his disease, medications, and treatments. I would want to ask him if there are any topics he would like to review or go over. I would then want to provide chunks of education from time to time as needed. An important skill a RN must have is delegation. When delegating a task, the nurse is ultimately responsible for the safety of the patient. It's important for the nurse to check for competency of a staff caring for the patient. I would want to make sure that the nursing assistants working with RM are competent and safe in their skills, such as transferring and ambulating, since RM is a flawless. Staffing levels are a major concern for skilled nursing facilities, as they are constantly understaffed. There is a high turnover rate at the facility, which affects staffing ratios as well as productivity. If need be, the risk manager will have to use staffing agencies to cover the appropriate staffing needs of the facility. As a risk manager, in order for the staff to have the most up-to-date competencies, there needs to be organized training sessions on new skills as well as reviews of skills in the latest practices. Unless something is documented, it did not occur in the nursing field. A nurse needs to document every action, interaction, or intervention in the patient's medical chart. Any incidents that occur with RM need to be filled out with an incident report. There was one incident where there was a miscommunication between two nurses, and RM received 2 doses of pain medication. This needs to be accurately documented for his safety as well as for quality improvement issues. Utilization review. The appropriate utilization review service for RM would be concurrent review. This is because RM is currently in the skilled nursing facility and has been so for the past year. The utilization nurse would be assessing for the suitability and need for skilled nursing. A continued stay review would be performed at specific points during the patient's stay at the facility to determine if the stay is necessary and they are willing and they are receiving the appropriate level of care in the correct setting. A utilization review nurse is important. As a utilization nurse, it's important to make sure that the documentation of the patient's status is accurate and detailed to determine the needed level of care. Objective data that portrays RM's need for skilled services would be patient's oxygen saturation dropped down to 82% on 2 liters per minute when ambulating 20 feet with a front wheel walker. Clinical data such as lab tests, such as ABGs, would provide proof that RM is still not medically stable to be caring for himself at home. RM has had several COPD exacerbations and needed to be transferred to acute care for stabilization. Anytime this occurred, there needs to be detailed documentation on why the transfer out to a higher level of care was necessary. The unit manager, the utilization nurse, should also ensure that there are detailed care plan notes on the response to interventions such as medications, respiratory treatments, and physical therapy progress. Quality and safety. Part of a nursing essential duty is to keep the patient safe. Patients need to be kept safe by nurses following a set of standard practice guidelines. And one of these standards to perform nursing procedures according to nursing standards. A standard is to properly administer medication. RM experienced a failure of this standard. During one shift, his primary nurse, who was an LVN, miscommunicated with an RN supervisor about giving a dose of pain medication. He ended up getting 4 tabs of Norco 7.5 milligrams. It ended up causing him to go into severe respiratory alkalosis from the overdose, and he ended up having to go to the hospital for higher care. He did return safely to the facility after receiving acute care services. Nursing case effectiveness at the system level. The facility continues to have problems with staffing, although they have been recently been able to not use staffing agency workers. They have been able to hire more full-time employees, but shifts continue to be short nurses and nursing assistants. And staff are asked to do overtime on a daily basis. The staff development nurse holds bi-monthly training sessions on various practices, such as how to prevent UTIs, fall prevention, and pressure ulcer prevention. I have continued to build a trusting relationship with RM and offer emotional support to him. Even when I'm not his assigned nurse, I will check in with him and see how he's doing. He has been improving with his ambulation, and he has said, "I think I'm going to get out of here soon." As busy as I am caring for 12 to 16 patients, I always take the time to hear any of his concerns and talk to him and hear his stories. He also appreciates any education or updates on his medication or lab values. Here is a slide of my references, and thank you for listening to my presentation.